Dr. Eugene Cherny, talking about some important aspects of your business.
Good morning. Great to see you guys.
Yay. Yeah.
Hey, well, let's pick it up where we left off last week. Last week we were talking about Breast Cancer Awareness Month. It's October. You know, and my specialty is plastic surgery, and we're just intimately involved in breast cancer awareness. Although we do make breasts bigger, we make them smaller, we make them even if they're crooked, but we think it's one of our better things that we do is to reconstruct them when they're lost to cancer. And so this is what we probably should touch on today, breast reconstruction.
Now, full disclosure, women, we get our yearly exam. We're supposed to, and hopefully everyone out there does, besides doing the usual, everything else you should do on top. And for me, it's strange when the doctor starts talking to me about going to see a genetic doctor. They ask you your family history, and if anybody below, I think it's 43 years of age, had cancer in your family, they highly recommend going to a genetic doctor, which quite a few people are doing now.
Yes.
Because if you have a certain genetic in your family, a lot of people opt to get rid of everything to kind of preempt getting cancer.
Well, here's the trend. The trend in medicine, I mean, this is a very exciting time. I teach students at the medical school, and this is a wonderful time to be in medicine because it was probably about 20, 30 years ago that they detected the entire human genome and mapped it out. And now they're starting to really apply that to science. And so what's going to happen is that if somebody gets cancer in the future, they're going to have your genetic map, and then you're going to have the genetic map of the tumor. And based on those two things, they're going to get a drug that will specifically zap that tumor individually. So cancer is going to be an individualized drug, the chemotherapy agents in the future. As it starts now, we know that there's the breast cancer gene. There's two types. And two people, if you'd like to talk about them, that have this, had mastectomies because their risk was so high with this gene being positive. So this is why you go to a geneticist.
So it was a preemptive strike?
Oh yeah. Well, when the risk is like so very high, you know, you take it. Like Angelina Jolie, for example, she had maybe a 90% chance of getting cancer. Best thing for her to do was just to have them both removed, actually.
And that's exactly what she did?
Yes, she did. And
the gal from E! Network?
Yep, this is Jillian from the E! Network, another person who had the genetic testing done and decided, well, I don't really think she had boobs to begin with, but she decided to.
Yeah.
Kidding.
Oh, no.
She had him taken off and then rebuilt. Christina Applegate,
that was
another one.
That was one that got so much attention when she did that.
Yes, she was one of the first. She was one of the first, and so with getting both breasts removed, not only do you take away your cancer risk on both, but I have to tell you, as a plastic surgeon, it is so much easier to reconstruct two than to reconstruct one.
Oh, because you have to match.
Yeah, if you have one that you want to match the other one, that is amazingly hard. But if you remove both at the same time, it's much easier to get two relatively even equivalent looking breasts.
And all three of those women were, for one reason or another, urged to go see a geneticist, get the testing done.
Right.
And that's how it all began in those cases.
Right, and this is actually in Des Moines, this is what everybody is getting now who has breast cancer. Everybody's getting tested for that gene now if there's a family history, and the science is improving. And
how long of a process is it, doctor, if you want to get tested?
The testing probably, this is the kind of a test takes longer. It takes probably a week or two.
Okay.
And then then you need some time just to really think about what you want to do and to talk to your cancer doctor and come up with a plan on what to do.
Because many feel that this is a really dramatic way to go. It's like if you have no cancer in your body right now and you're doing something this drastic, is it worth it if you know maybe down the line you could be getting cancer? Yeah,
some say it's to the extreme.
It is extreme, but if your likelihood is 90%, I think some people will opt to watch instead, but I think that when it comes to a statistic that high, 90%, probably you can never have peace of mind, you know, with that type of a thing. You probably won't have peace of mind until you have the surgery. That's what we see. I see patients even that have lumps in their breasts that I think are completely benign, and I tell them it's almost certainly benign. I wish you wouldn't worry about it. And they don't rest until I do a biopsy and get that lump out. So it's very hard to bear that psychological stress.
Once you know that news.
Once you know about this kind of thing, yes.
Now, if you do completely remove the breasts and have this surgery done, is there still a chance that you could get breast cancer? But because they've completely been removed, there's no chance.
There's a theoretical, very small possibility. The mastectomies that are done here are not like the radical ones that are done for cancer. You do sometimes they do, for example, nipple sparing mastectomies where the nipple is left behind it. It's less disfiguring, but since the cancer travels up the milk ducts, that is where we worry that there might be some residual cancer later. So there is, maybe. It's maybe down to 0.5%. It's extremely rare, after a mastectomy to develop breast cancer. But that's the problem with medicine. Kind of almost anything is possible. So you always have to couch. I always have to couch what I say, in these cautious terms.
But
So it's like meteorology then.
if you're going from 90% to less than 1%, that's a big difference.
Yeah, that's a huge difference. And all these people here that have had these bilateral mastectomies, they had the most common method of breast reconstruction, which is tissue expansion and a breast implant. Same type of breast implants that we use in the cosmetic surgery we use in breast reconstruction as well. And just sometimes in a more sophisticated way. Sometimes, like I, for example, like to use the implants that are shaped when I do breast reconstruction for a more natural outcome, as opposed to the round ones that we do in a aesthetic breast augmentation.
Got it. All right, so people have more questions about this. They can get a hold of you, can't they?
Oh, you bet. You bet.
This is how you get a hold of Dr. Cherny. 254-2265 is his phone number. Heartlandps.com on the internet. Stop by. You can visit them. Easy to get to right off of 35 there.
And most importantly, for Breast Cancer Awareness Month, just make sure you stay aware of your body and get checked.
Wonderful.
Yes. One important thing about Angelina Jolie, with her great celebrity, she actually increased the number of women going for breast exams and mammograms. In the nation of England, it was up by 2.5%, and it lasted for like a year.
Wow.
So many more people came.
Some good awareness.
So of her trouble, something good came, and I hope that with these talks, more people will be more careful.
There you go.
Dr. Cherny, good job, man.
Thank
you,
you.
sir. All right, buddy.
Thank you.